You are listening to episode 17 of Present Moment. Welcome to Present Moment, Mindfulness, Practice, and Science. I'm Ted Meissner. Present Moment is a podcast with interviews, conversations, and roundtable discussions. We speak with mindfulness researchers about their newest findings published in peer-reviewed science journals, teachers about their understanding and methods as they work with students of mindfulness, authors about their books and interests, and we also speak with everyday practitioners. The website presentmomentmindfulness.com has show notes for each episode along with resource materials. Lucia McBee joins us to speak about her book, Mindfulness-Based Elder Care, a CAM model for frail elders and their caregivers. As our population ages, many of us find ourselves in the position of caring for elderly parents and other relatives. Perhaps those we love are doing well in their golden years, and perhaps they're facing some difficulties that come with having lived a full life. And mindfulness may provide some help for our elderly and for their caregivers. Lucia McBee has worked with elders, high-risk populations, and persons with chronic conditions, as well as their caregivers, for over 25 years in a wide range of community, research, and institutional settings. Lucia has participated in professional training in mindfulness-based stress reduction at the Center for Mindfulness in Medicine, Healthcare, and Society, and in Mind-Body-Spirit Medicine at the Center for Mind-Body Medicine. Employed for 17 years in a nursing home, utilizing mindfulness-based interventions with residents, staff, and family caregivers, Lucia is currently Program Coordinator for Integrative Medicine at the Center for Comprehensive Care. Her presentations regularly include national and international conferences. I also wanted to say a special thank you to Guy Robertson of Positive Aging Associates for his help ensuring this interview could take place. And our guest today is Lucia McBee. Lucia, welcome to Present Moment.
Hi.
So tell us about your background. How did you first encounter mindfulness in your own life?
Well, it's kind of complicated. I was a practicing meditator for on and off over the years, and also I practiced yoga on and off from my early years, like after college. But I really came to mindfulness when I saw the program Healing in the Mind with Bill Moyers and John Kabat-Zinn, and he talked about how this practice had helped people with chronic pain. And at the time, this was probably around 1990 or early 90s, I was working in a long-term care institution, a nursing home, and I was working with people who had a lot of chronic pain. And going back a little bit, at that time, pain was really just treated by medication. And for older people, it was just expected that they would have pain. So as a social worker, I felt like I wanted to try something else. And this looked like something that would be very helpful. So I got the book, Full Catastrophe Living, and started doing the practices for myself. And I guess that was the big awakening for me too, is that I got the book to help the people I worked with, but really it helped me tremendously. So I began to see the benefit of this practice in so many ways. So I started the practices with myself, and then I started adapting them for older adults.
So was that your profession at that point? You'd had a mindfulness practice on your own, but you were already involved in elder care?
Yes, I've been involved in elder care For about the last 25 years in a variety of settings, starting with community settings, but then mostly working in nursing homes and long-term care with people who are quite frail, often confused, and their professional caregivers, especially the nursing assistants, as well as family members.
So, what prompted you to write the book?
Well, if it's not coming across, I'm very, very passionate about this subject. And also, I felt like our elders have been left out of the equation in so many ways. I feel like they're a growing population, there's huge need, and yet it does require a certain kind of special, not necessarily training, but just special understanding to work with older adults and to learn to adapt the practices for older adults. And I'd been doing it for so many years. And I did develop a habit of kind of documenting what I did through the years. And I did a lot of presenting and talking to people about what I was doing. But when it came to writing the book, it was a great way to bring it all together and kind of get this out to the bigger public about not only just the need for this population, but the joys of working with this population. And also actually a lot of the really practical thoughts about how do you teach somebody who can't remember things? How do you do yoga with people who can't get out of a wheelchair? So the book really kind of goes through that. It really outlines specifically the practices as well as the underpinnings of why these practices might be helpful and how they can help specifically their frail elders.
So, tell us about the book itself. What's in there? What's the structure of the contents?
Well, again, it's a lot of practical advice, a lot of practical thoughts on how we can work with older adults. But it also, again, it's about the heart of the practice too, and why this practice still can be meaningful, even for people who might not be able to understand it or who might not be able to sit through a 2-hour class or go on an all-day retreat, that these practices can be so helpful. And I've really been talking about older adults to start with, but I also want to bring in the caregivers because really, as I see it, you can't separate caregivers from the older adults. And this is what I kind of came to as my practice kind of evolved with older adults. I started bringing the practice to older adults and I started running small groups in the nursing home and seeing, what adaptations I'd need to make for working with our older adults. For example, the need to speak more clearly, maybe simplify the language, make accommodations for either hearing, sight loss, or, physical disability. So, making those accommodations, making the group shorter. The homework expectation was something that I let go of pretty early on because it just wasn't being done and for a number of reasons. But still, I saw an effect from the group. But again, as time went by, I started realizing also that the residents, specifically in the nursing home, were, even though they were doing the practices and benefiting, I could see a difference between the beginning and the end of each group that I ran, which included mindfulness meditation and breathing exercises and simple stretches and some discussion. So these would be the groups with the elders. I would know that they'd be going back to a nursing home floor or unit or whatever you want to call it, to a highly stressed staff. The staff in nursing homes really work very hard and they're under a lot of pressure and under huge regulatory demands by the government feds and state governments. So there's a tremendous amount of pressure and, there's little economic resources. So I could see the stress in staff, and I started realizing that working with staff would probably have a bigger effect with older adults than working just with the older adults because staff needed to reduce their stress. And from that, I also started running groups for family caregivers who are also, from my work with them, I knew were to be tremendously stressed. Family caregivers, if they want to choose a stressed out population to study the effects of stress reduction on, people who care for Alzheimer's patients are usually the one they pick because it's one of the most stressful things that anybody can do. So, clearly there's a need for stress reduction, but with all of these populations, there's also challenges. So with the professional staff who work with older adults, some of the challenges, especially for the direct care staff, are that, most of them are very hardworking and very underpaid. The certified nursing assistants or home health aides, are at the lowest level of income. They also have the highest injury rate and one of the highest rates of depression because it's extremely challenging work. Most people go into it because they really do care about people. But, when you have a job and you can't even have your own health insurance and you have to keep two jobs to keep yourself going, it can be pretty tough to be, it can be stressful. But again, given all the other circumstances, this population also finds it hard to set aside like time to go to a yoga class at night or to take a mindfulness course. So I also worked a lot with ways to adapt, whatever setting I could to bring the mindfulness. So I did give some classes within the home where people were released for the time. But mostly what I find myself doing was going up to the floor or the unit and bringing some of the skills with me, whether it's just a 5-minute meditation, a 3-minute yoga stretch. So just in whatever way I could capture this audience and give them some tools to help them cope with the challenges. And also thinking about how to bring this stress reduction into their caregiving role. And the same with families. I mean, families find it, even when their family member is in the nursing home, they find it very, very difficult to take time for themselves. Many of them, especially the children, are working a full-time job, may have young children of their own, and yet still committed to visiting on a regular basis and feel that they really have to be there for their loved one. Spouses may be older, so they have their own health issues, but they feel most family caregivers find it very difficult to take care of themselves. And so developing groups for them and finding ways to bring mindfulness to this population was also another challenge. So this is a long answer to a short question, but I think talking about my work and why I think caregivers and elders, are kind of meshed in this highly stressed kind of, you might say, cauldron, really cries out for some kind of practice that would bring relief. And I think mindfulness can be one option and a very powerful option.
Why do you think the information in the book is important for elders and their caregivers? What's the goal that you would like to see happen from people?
I'd like to give them tools. I mean, I don't think anybody is going to deny that they have challenges and stress in their life, but I do think that it's possible to also find some quality, no matter how many challenges we may have, to find some relief in the mindfulness practices. So I hope and that's why I was so practice oriented in my adaptations, that I could find ways that anybody, even if they, had very little time or very little cognitive capacity, could incorporate this into their life.
So what are some of the stories for you that you have found personally moving or inspirational over your work in the years, or maybe in putting the book together, that is something you'd like to share with people who are listening?
Well, I think I had very powerful experiences within the groups. You have to imagine the context that I'm talking about. And if you haven't been there, just to give you a little sense of that, we're talking about an environment that's fairly hospital-like still, although many nursing homes are now transitioning to a calmer environment. At the time, we had call bells going off, we had overhead paging, people walking in and out of the room. These groups were run in kind of a really disruptive kind of environment, lots of potential for things going one way or another. So what I did was I tried to bring, a sense of our own milieu, even in the midst of all this, because we didn't have a private room to teach in or anything. I was teaching right in a dining area where we were open to everybody. So I brought in some calming music, and I brought in a little aromatherapy diffuser, so that we could kind of create our own milieu, even in the midst of this environment, because I finally realized that there was not going to be a peaceful place that I could gather people. And this is where, even though I could go home at night and find my peace, the residents in the nursing home lived there day and night, and this was their home. And to find some way to find a sense of peace and quiet in the midst of this. So I think that is one of the things that residents appreciated. They're called residents in the nursing home. The other thing that people seemed to really appreciate was the underlying sense of what we teach in mindfulness-based stress reduction is that there's more to us than our problems, more to us than our illness. And in the context of a hospital-like environment where the focus is so much on illness and things that are problems, to be in an environment in the group setting where we were talking about, well, in the yoga context, so you can't reach up your arm all the way. How far can you reach it? So working with abilities and not disabilities. I mean, that's hugely empowering. And I think one of the things that happens as we age is that we feel more and more disempowered. I mean, imagine the life of somebody who has to ask to have a glass of water, or even more fundamentally, to be taken to the bathroom, and then maybe have to wait for that person to come to go to the bathroom. How do we deal with this? And that's what we focused on in the group. What happens when you ring the call bell and nobody comes? How can you cope with that? And we talk about ways to do that in the group. So we can't change the fact that you might have to wait for somebody to take you to meet this very fundamental need. And it might feel very demeaning, and you might feel ashamed and vulnerable. Can you breathe into that?
Our guest today has been Lucia McBee. You can find out more about her work on her website, luciamcbee.com, which I'll be linking on the episode page for this episode. Lucia, thank you for joining us.
Thank you, Ted.
Thanks for listening. If you'd like to hear more about something you've heard in today's podcast, please come visit the website at presentmomentmindfulness.com. You'll find an entire webpage devoted to this and every episode. You can comment on the episode page and find show notes and other helpful resources for your mindfulness practice. The shakuhachi music heard on Present Moment is used by permission and through the generosity of musician Rodrigo Rodriguez. His website is linked on the Present Moment website on the About Podcast Music page. Sound editing, mixing, and mastering provided by the generosity of Anthony Dominello of StructureFromSound.com. Until next time, remember, every moment you have a choice. Make it the best you can. See you next time on Present Moment.